Okay, next we have surgical methods. We have vasectomy and tubal ligation. These are very, very effective methods used around the world. Most common in globally, second most common in the United States. They can be performed outpatient in an office. They can be done in a surgery center. You can do them when a patient is postpartum. You can do them during a C-section. Surgical procedure with associated risks. So this is something the patient needs to have informed consent before it's done. The risk of bleeding and infection with any surgery is always present. In this particular surgery, very, very, very rare, less than 1% for both. The big thing that you want to make sure that you instruct the patient who's interested in this method is that she's sure she doesn't, he or she, the family is sure that they do not want any more children. Sometimes younger women will regret the procedure, and then they go through IVF to get pregnant with a new partner later when they're a little bit older. So you want to make sure that the woman understands this is permanent. You can't reverse it. The failure rate is 0.5%, so very low. You take user error out of the equation. And we have a male procedure, and that's vasectomy. It is safer and cheaper than tubal ligation, but fewer men have the procedure done than women getting tubals. Most of them fear pain. They fear, the threat of maybe not being able to perform during intercourse. None of that is really a valid concern. So you could instruct people. What the procedure involves is that there's a little tube that takes sperm from where it's made to where it exits. We cut the tube. It really doesn't interfere with anything else. Sperm is still produced. Testosterone is still produced. The act of intercourse is not changed. It's performed in the office under local anesthesia. A lot of urologists will do this on a Friday so that a man has a weekend to recover. Pain and swelling are usually very mild. You handle it with an ice pack and you rest on a recliner. It is a permanent procedure, although there have been case reports of it being reversed by surgeons, by men who want that procedure reversed. But the patient should get tested within 3 months to make sure that the tubes did not reconnect. Very, very effective. Again, less than 0.5%. We're going to move on to methods of natural family planning, things that do not require prescription, things like withdrawal, which is also called coitus interruptus, and abstinence. All right, so natural family planning, these are methods that time intercourse with the female reproductive cycle to avoid the time of ovulation if you don't want to get pregnant. They can also be used for the opposite reason. You can time intercourse with ovulation if you desire a pregnancy, and that's really probably the best application of natural family planning for most people. There are a couple different methods. We have the calendar method, which is, if you have a 28-day cycle, and there's whole books on this. This is not something that a generalist nurse would ever want to counsel. You have to have special training to teach people how to use this, or at least be able to refer them to a resource, a book or something. The problem is that you're trying to predict an event. You're trying to predict ovulation so you can avoid the intercourse. You also have to keep in mind that sperm live a certain length of time. They can live up to 72 hours. So you're trying to time it. You would refrain from intercourse from days 9 through 18 for a 28-day cycle. The Billings Method uses certain signs in the woman's body, things like the temperature increases with ovulation, mucus, cervical mucus becomes very thin and very stretchy, and people would avoid intercourse during those times. Failure rate is 25%, even with committed people. Part of it is adherence, but the other part of it is it's very hard to predict this. It requires commitment from both partners. It may be it's the only acceptable method for churches like the Catholic Church. And some people will use it because they don't want to be bothered with getting birth control or using it. So they'll kind of try to time it away from ovulation. Those people have much higher failure rates, generally. Withdrawal, also known as coitus interruptus, it's interruption of intercourse before the male orgasms. It's a common method in couples who have long-term relationships. They don't want to be inconvenienced, and they really wouldn't be devastated if there were a pregnancy. It has a high failure rate, 22%. So if you have somebody who really does not want to get pregnant, and this is the method that they describe to you, that's sort of a prompt for intervention. You get that patient something much more effective. And then we have abstinence. Now, if you guys are in middle school, I would sell this as a 100% effective method of contraception. It is 100% effective in theory, theoretically, but nobody's perfect. And a lot of times people will say, yeah, abstinence, that's what's for me. I am not having sex. And then what do you know? What they're actually using is called random chance. And that has an 85% failure rate over the course of a year. You guys are not in middle school. You are aspiring healthcare providers. And I will tell you, there are a number of occasions working on the postpartum floor. I might be counseling somebody who's 21 with her fourth unintended birth, unplanned pregnancies, and that person will look me straight in the eye and say, I am never having sex again. You don't need to worry about that. Folks, that is a lie. That patient's going to be pregnant again, probably see her in about a year or so. If your patient's sexually active, they've already had an unintended pregnancy, this is time for a realistic conversation. Yeah, right now, maybe you think you're never going to have sex again. Let me tell you about some options that might work better for you. And that's abstinence. And we're going to cut here because fertility really should be a separate video.